Aspiration is a serious concern for patients on enteral nutrition therapy. It can lead to aspiration pneumonia and other complications. Let's talk about effective interventions to minimize these risks. First, proper patient positioning is crucial. Patients should be positioned at a 30 to 45 degree angle, known as the semi-Fowler's position, during and for at least 60 minutes after feeding. This helps reduce the risk of reflux and aspiration by preventing gastric contents from moving back into the esophagus. Next, always ensure accurate placement of the enteral feeding tube before initiating feeds. Verification methods include auscultation, where you inject air and listen for a whoosh sound over the stomach, pH testing of gastric contents, and the most reliable method, radiographic confirmation via chest or abdominal X-ray. Choosing the right feeding formula is another key intervention. Thicker, higher viscosity formulas may be less likely to reflux compared to standard formulas. Additionally, consider specialized formulas designed for patients with swallowing difficulties or GERD. When starting enteral feedings, begin gradually to allow the gastrointestinal system to adapt. Start at a low rate, like 10 to 20 ml per hour, and increase incrementally based on the patient's tolerance and clinical status. This helps minimize the risk of gastrointestinal discomfort and potential aspiration. Regularly monitor patients for signs of gastroesophageal reflux during feeding. Look out for coughing or choking, frequent regurgitation or vomiting, and increased respiratory distress or changes in lung sounds. Adjust feeding rate, formula, or positioning if you observe these signs. Administer feeding slowly and with proper techniques. Gravity feeding allows for a slow, steady infusion, which is less likely to cause aspiration than rapid feeding. If using a feeding pump, ensure the rate is set appropriately and monitor for any signs of discomfort. Maintaining proper oral hygiene is essential to reduce the risk of aspiration pneumonia. Perform oral care at least twice daily using a soft toothbrush and antimicrobial mouthwash. Ensure adequate hydration to keep the oral mucosa moist and promote saliva production. Continuous monitoring during enteral feeding is vital. Keep an eye on respiratory rate and effort, oxygen saturation levels, and lung sounds for any abnormalities such as wheezing or crackles. Finally, provide education and training for staff and caregivers on best practices for managing patients on EN therapy. Topics should include correct positioning, tube placement verification techniques, recognition of signs and symptoms of aspiration, and safe feeding practices. By implementing these interventions, you can significantly reduce the risk of aspiration in patients receiving enteral nutrition therapy. Proper positioning, vigilant monitoring, careful selection of feeding formulas, and continuous education are essential components to ensure patient safety and improve outcomes. Thanks for watching.